AVPD, from the other two cluster C disorders, is the core feeling of being inadequate and unlikable that drives the anxious avoidant behavior. It is an introverted disorder. As a result, they may have difficulty forming and maintaining friendships and romantic partnerships. People with avoidant personality disorder have chronic feelings of inadequacy and are highly sensitive to being negatively judged by others. Though they would like to interact with others, they tend to avoid social interaction due to the intense fear of being rejected by others. It is estimated that about 2.4% of the US population has avoidant personality disorder. It appears to affect men and women equally. Like other personality disorders, avoidant personality disorder symptoms may be noticed in childhood and often begin to create discomfort in adolescence or early adulthood. It begins with children who were either disallowed proper parent-guardian relationships early in their youth or were abused by an adult in their developmental stages in life. Patients with avoidant personality disorder may have difficulty trusting others or feeling safe and secure within a relationship. They avoid social interaction, including those at work, because they fear that they will be criticized or rejected or that people will disapprove of them, as in the following situations. They may refuse a promotion because they fear coworkers will criticize them. They may avoid meetings. They avoid making new friends unless they are sure they will be liked. These patients assume people will be critical and disapproving until rigorous tests proving the contrary are passed. Thus, before joining a group and forming a close relationship, patients with this disorder require repeated assurances of support and uncritical acceptances. Patients with avoidant personality disorder long for social interaction, but fear placing their well-being in the hands of others. Because these patients limit their interactions with people, they tend to be relatively isolated and do not have a social network that could help them when they need it. These patients are very sensitive to anything slightly critical, disapproving, or mocking because they consistently think about being criticized or rejected by others. They are vigilant for any sign of a negative response to them. Their tense, anxious appearance may elicit mockery or teasing, thus seeming to confirm their self-doubts. Low self-esteem and a sense of inadequacy inhibit these patients in social situations, especially new ones. Interactions with new people are inhibited because patients think of themselves as socially inept, unappealing, and inferior to others. They tend to be quiet and timid and try to disappear because they tend to think that if they say anything, others will say it is wrong. They are reluctant to talk about themselves, lest they be mocked or humiliated. Patients with avoidant personality disorder are very reluctant to take personal risks or participate in new activities for similar reasons. In such cases, they tend to exaggerate the dangers and use minimal symptoms or other problems to explain their avoidance. They may prefer a limited lifestyle because of their need for security and certainty. Psychotherapy or talk therapy is the primary avoidant personality disorder treatment. Psychotherapy may include cognitive behavioral therapy, which focuses on reducing negative thought patterns and building social skills.